we're discussing the youth in crisis on the North Island, specifically in Port Hardy,
Yeah.
due to drug overdoses and suicides. What specifically do you see as a need to help combat this?
Yeah. So, I've had the opportunity to work in this community for the past year and a half. I worked over 50 emerg shifts at Port Hardy Hospital and a handful at the Port McNeill Hospital. Um, when there's an emergency, you need to go to emergency. And we've had too many kids and youth, and frankly, they're kids, right, that are in emergency and are suffering and are dying because we don't have an open emerg in Port Hardy. An emerg that closes at 5 p.m., that's not an emergency room. And so, I've had patients who are senior paramedics in our community, and they've, had to declare these kids dead in their ambulance on the way to Port McNeill because our emerg is not open in Port Hardy. So immediately, we have to reopen that emerg. And it's not complicated. It's only political will. And, I've called repeatedly on our leadership in terms of our Member of Parliament, Rachel Blaney, our Member of the Legislative Assembly, Michelle Babchuk, our Mayor, Pat Corbett-Labatt, and our Council. And we need a state of emergency if we are unable to open this emerg 24/7. Frankly, I think if the political will was there, it would be open just like that. And for reasons I can't understand, it's not. Port McNeill is a quieter emerg. The patients are less sick. Yes, Port McNeill needs an emerg open 24/7 too, but there's no justifiable reason why a population here in Port Hardy and our reserve communities, predominantly First Nations communities that are feeding our emerg in this crisis, why we don't have a 24-hour access to emerg. It's a crisis. And, I've had the great privilege to do a lot of work in my 12 years as a doctor. I've worked in northern Manitoba and northern Quebec, and worked in a lot of First Nations communities. And I've worked with a lot of youth in crisis. And I've been in communities where there's been deaths, and I've seen what happens. I'm a white settler, and I don't come from as tight-knit a family as I see in some of my First Nations patients. These families are very, very strong, their bonds, and they're tight, right? And a loss, it's a chain, right? You can't break a shackle, you can't break a link without destruction of the strength, right? And so, the youth are everything in these communities, everything. And we're losing them, and we're losing dozens in weeks. A single death is a tragedy, and yet somehow we're numb. We're numb to this. The GNN First Nation declared a state of emergency. And what have I heard in the national and regional media? Nothing. No one cares. No one's paying attention. And, on CBC radio, I was listening and they were talking about an elk in Yubu that had been hit. And it was apparently a famous elk in Yubu. And they spent 10 minutes on CBC Radio Victoria, which covers our North Island. And they were talking about this elk. And I was driving home from having to counsel a patient who'd lost her son. And CBC Radio was talking about an elk that had died. And so, yeah, this is an immense tragedy.
It really is an immense tragedy. And I give kudos to the GNN for declaring a state of emergency. I would really like to see our local mayor and council do the same thing. Because, as you said, these are First Nations people, and they deserve as much help as anybody else. People are people. And this is a tragedy that, if it was happening anywhere else, would get media coverage that would just be mind blowing. But there hasn't even been a peep. Thankfully, today, maybe we can rectify that.
That's, I take my commitment as a medical doctor, to heart. I've become very privileged as a white settler from a family of medical doctors. And I've seen my grandparents as strong advocates for their patients and their communities. I've seen my dad and my aunt and my uncles as strong advocates for their patients and their communities. And from my perspective as a family doctor, one of our CanMed's 5 principles of being a family doctor is advocacy. And from my perspective, I have no choice but to be here today with you.
Right. And we appreciate that. We need physicians who are willing to speak out. We need political figures that are willing to speak out. We need the general population of the North Island, specifically Port Hardy, to speak out of, regarding this tragedy of our youth. If you don't have youth, these youth aren't going to, they're not growing up to be old people. And when they don't grow up to be old people, our society is, what's going to happen to it? It's we
Hope.
need we need to do something, and we need to do something today. We can't wait. We can't do investigations. We can't do, get a group of people together to discuss it. We see what the problem is. We know what the answers are.
Young people are hope. Youth are hope. And, we see every day, I see 40 to 60 patients as, at the North Island Community Health Center, and a good number of those are First Nations patients. And most of the patients above 30 are scarred by the trauma of residential schools. And so the youth are the hope. They're the chance to break free of the trauma of residential schools. We are stripping them of hope right now. Our lack of leadership, our lack of an emerg open 24/7 in Port Hardy is stripping another generation of hope.
Yes, I agree. It's a lack of almost caring.
Institutional racism. I think as individuals, people care, right? I think if we sat down with any of the people we've mentioned, any of the leaders, I think they care. I truly do believe they care. But our institutions foster racism. And the minute one life is less valuable than another, you've lost the story.
Yeah, yes, absolutely. The managed alcohol program that has become sort of a pilot project in this area, which is scary. We already have, or before this even happened, we already had an alcoholism problem on the North Island, regardless of race. And now with this managed alcohol program, it almost seems to have exacerbated that issue.
And I've been asking, I wrote an email 2.5 weeks ago to Island Health Leadership asking for some of the data in terms of the GMAP managed alcohol program and what the outcomes are and the evidence that it's saving lives and helping reduce alcoholism in our communities. And that's 2.5 weeks without a formal reply. And I've sent a reply again, reply all, as this crisis has built. And I've discussed this in detail with Dr. Howie Lee, who served as a physician for this community tirelessly for over 15 years working emerg, who's revered in this community. And Dr. Lee's been adamant. We've lost the story, right? With this situation, if you're giving out alcohol and you don't have an open emerg and you've got a diverted safe supply of dillies on the street and fentanyl, you're using alcohol, you're not, judgment's off, you're using substances, you're overdosing. sirens are going, there's no emerg open in Port Hardy.
And oftentimes, because there's no emerge in Port Hardy, these people who are in dire straits are put in an ambulance to be sent to Port McNeill Hospital, but they're on diversion to Campbell River,
That's right.
which is 2.5 hours over very remote areas and who knows what kind of road conditions, especially at this time of year, to get to medical aid.
That's right. And this is unnecessary.
Completely.
We have at the North Island Community Health Center 4 family doctors who are skilled. We have an allied healthcare team. We just got a McDonald's in Port Hardy, and we can't keep an emergency room going. We don't lack for doctors. We don't.
No.
We don't lack for nurses. We don't. We lack for the political will.
What do you see as just this probably won't hit the air, but what do you see as the solution to this political unwillingness to care about our youth on the North Island?
Well, I think I've tried my best to advocate for the health care of my patients and our population. That's sometimes led to a bit of conflict with our health authority. And so, I've had to come back and go back to basics in terms of where I see the difference I can make. And that's in helping to give meaning and purpose to these young patients and these young citizens and these youth, these children, to give purpose to their lives. And so, when I worked in northern Quebec, in Mistissini, when I worked in northern Manitoba, in Red Sucker Lake, in Chibougamau, I, saw the power of sport and a rec center, people going out, having an opportunity to go. And I loved that as a young doctor. I would go and, I'd knock on the door of the principal, I'd knock on the door of the community leaders. I'd always bring my hockey skates up, I'd bring my cross-country skis, whatever I could do to demonstrate active living and engagement. And so we'd play soccer in the gym, we'd play floor hockey, we would dance to music, we'd share soda, right? We'd do these things that are community building. And, I think some people might have thought it was a bit weird that this young doctor is, interacting with these young First Nations kids. But I've come to appreciate that that's the best medicine.
That's normal. That is what we consider normal child behavior, normal teen behavior. That you get together and you play floor hockey, or you play soccer, or you get together as a group and you do something, you go to a dance, those sorts of things. Not, dying
Not
because
dying.
you've had something to drink and you've decided to try something for
That's
the
right.
first time, and it's laced with God knows what.
That's right. And this story needs to be told, right? Is that there needs to be a pause and an examination of what's happening right now with programs like the managed alcohol program, with programs like the managed hard drug program, where we're seeing there was a big, a big investigation where diverted safe supply hydromorphone, this is dilaudid, this is a hard drug that I'd take one and I'd be dead, is getting onto the streets, and it's getting into kids' hands. And we're paying for this as taxpayers. We need to think hard about what society we're creating. And again, there's much smarter people and capable doctors who are trying their best to sort out these problems, and we need to listen to them and follow the evidence. However, we can't have programs like we are doing with alleged safe supply without a functioning emerg. You just can't. You can't have those two things. And the fact that our mayor and council and MLA and MP have tolerated this must stop, and it must stop. Mm-hmm. Our political leadership must act. It must. This cannot be tolerated anymore. And, you know, the leaders, the matriarchs in our First Nations communities, the aunties, the grandmothers, the mothers who are just torn, right? The pictures that I see of their children, their loved ones, their babies that they post that they've lost, right? That's not right. And these are our neighbors, right? They're people we see every day. They're the people we're running into at Save-On, at McDonald's. And yet these same people are standing up and organizing. They're creating these spaces, and our First Nations have donated rec centers and rec space. And this past week, we've had every night, there's been gatherings of youth, dozens of youth, and beautiful pictures amidst this tragedy of youth playing, right? Celebrating.
Being kids.
Being kids. That's harm reduction. Mm-hmm. Being a kid is harm reduction. Alcohol, hard drugs, no matter how safe a supply, that's not harm reduction for kids. So, you know, I look to these women, right? I look to the matriarchs in our Indigenous communities for where I can contribute something. And I'm not a wealthy person. I'm a doctor, and we're sitting here in a house that I was privileged to work with a local builder to put together. I carry a lot of debt from that. I spent over $250,000, that's debt, building the North Island Community Health Center to serve our community. I have a lot of debt, but I'm also incredibly privileged. And so I see an incredible urgency in creating a space that's 24/7 accessible as demanded by these matriarchs. They need this space where kids can play, where kids can be kids, where kids can share a soda together and share snacks and dance to music and make art and do drama. The things that maybe their parents as residential school survivors never had a chance to do. We have this chance, right? We have this chance. We can do this. So, you know, from my perspective, I can take more debt on. And so I've committed $100,000 of my own money on behalf of the North Island Community Health Center towards such a facility. And things cost money. That money will not create it in itself. We need our Lions Club, we need our Rotary, we need our business leaders, we need our politicians, we need our First Nations, we need all hands on deck to stop this tragedy of youth death.
Absolutely. It's not one man that's going to fix all. We as a community, we have to help our community. And regardless of whether you're First Nations or not, it is still your community. And you have to care about your community. You have to care. I personally don't have any children, but I care about all these young kids that are making one silly mistake, and it's such a huge burden that they're having to pay. Like they die.
That's right. You know, I look at the number of mistakes that I made in, my childhood, and I was, my parents got divorced when I was young, but otherwise I had a pretty darn good life, right? In terms of the adverse childhood events score that I've got, it's something, but it's nothing like the patients I see from these communities. This is not rocket science. There's no magic to this. We need a 24/7 open emergency room. We need a safe 24/7 space for kids to be kids. That's it. That's it. Don't let the politicians tell you it's complicated.
Well, we need a third thing, and that is people to actually get up and do it,
That's right.
to care,
That's right.
to actually put themselves out a little bit, whether it's financially or time or collecting information that needs to be collected in order to actually get these things done. Sitting in our living rooms complaining is not saving a single one of these kids.
No, although that's what I'm doing at the moment.
True.
But yeah, no, for sure. And I think we have to laugh about it too. In amidst the tragedy, we have to rejoice. And when I say laugh, it's not laugh at the tragedy.
No.
It's laugh at, our common humanity and the fact that we're all just human and we're going to frankly fuck up sometimes, but we have to try. And right now, the people in power don't seem to be trying, and they have to meet the moment. This is a tragedy. This is a crisis. I see patients who were delivered by Dr. Jack Pickup, all throughout the North Island, right? I see, I've got 1,500 patients in my practice. I see a lot of people. I see a lot of people who are born and raised North Islanders. They've never seen anything like this.
No.
This is without precedent. Sirens going day after day, morning after morning,
Multiple sirens.
night after night.
I, too, am a long-time North Islander, and the amount of sirens that I have heard in the last 6 months has increased exponentially to any other. Like, even if you collected all of the time I've been together, it still would be more than that time.
And I think, also we have to look at the collateral damage of these deaths too, right? Those sirens, there's people behind those sirens. We just hosted, our mayor and council and Legion, and hosted the Wounded Warriors Run, which is, paramedics and first responders who've been traumatized in the line of duty. We are actively traumatizing our first line responders by not supporting them, by not giving them an open emergency room to deliver their patient in Port Hardy, by forcing them to declare a child dead in their ambulance on the way to the nearest emerg because ours is closed.
Makes you sick. It really does.
I'm gonna cut in just a little bit.
Mhm.
So yesterday there was a news recording done. The Guasmo Nakwara finally agreed for Dean Stoltz to come in. They've been sort of kiboshing it all.
I don't know who Dean Stoltz is.
From Czech TV.
Oh.
So he came up yesterday while I was down in Victoria. He sort of mentioned to me, he goes, they finally let us come in. They've been trying to get in, and I guess the GOA?
I don't know.
I can't remember his name. The individual who was in charge of getting in contact for the media and stuff on that release that they put, they kept trying to deny allowing to have any media coverage on this.
Yeah, but this is much bigger than one First Nation, right? This is I'm seeing lots of patients that live in the district of Port Hardy that are impacted. This is not just a health issue. This is not just a medical issue. This is a social crisis, right? I spoke with one of our counselors, long-term counselors, yesterday, and this counselor told me it's a health issue. It's a health jurisdiction. That's not our job. And I was crystal clear. This is a social crisis. This is the very fabric of society that's falling apart in front of your eyes while you are in charge. So, I had a follow-up conversation with our mayor, and we have a very good and healthy, understanding and line of communication. And of course, there's a few things we disagree about. Disagreement can be healthy. And I really strongly, firmly believe Mayor Pat Corbett-Labatt has nothing but good intentions and is striving to do the right thing. This is a difficult situation. And I commend her for her leadership. And I would only say, whatever we're doing, it's not enough. We have to do more.
We have to stop being a society of having that knee-jerk reaction of when it happens to you, then you care.
That's right.
You have to care about your neighbor. We've become very isolated people, partially due to COVID, partially due to, I think, social media, not really having to have the social interactions that we did when we were kids.
That's right.
And I think that we have become a society who really doesn't care too much about what's going on with our neighbors. And that in and of itself is a tragedy, and I think it's systemic as to what is occurring now. It is sort of the catalyst, and we're now reaping our rewards, and it's not worth reaping. Like, this is not the reward we want.
Well, yeah, I mean, it's hard not for it to feel a bit surreal, honestly. Like, you can get your soft serve ice cream at McDonald's and walk down the road, yet we've got this, crisis of suicides and overdoses in our streets. And I keep catching myself because I go to Guido's and I get that coffee and I walk down the street and I think, why does this feel so normal? It's so abnormal what we're in. And so, I hear the comment that way in terms of, yes, we've become a bit of a voyeuristic society. We, see, we take in, we snap, we scan, but we don't engage in a meaningful way. And, again, this is where I'm looking to the First Nations women, the matriarchs in these communities, because they, as far as I can tell, more than anyone else, are the exception. They live this. They feel this. There's 7 generations of strength behind them that guide them. And so we have to follow the wise voices and the elders in our community, and they have the path. They have the prescription, right? I can't prescribe a medication that's going to fix this, but they've got a social prescription. And with that intervention, we can turn this ship around. For sure we can.
Absolutely. Not only can we have to.